Hey, this is Dr. Valladares here at Vixen Plastic Surgery. Good morning, dolls. I have a lovely Vixen doll. She just had surgery yesterday. This is Denisha. She's 27 and she came for her second round BBL. Denisha, this is your second round. What did you want when you got your first round?
I laid a lot on my sides for my first round and I ended up losing a lot on my hips. This time around, I really wanted to focus on my hip dips. I gained weight as well, so I got a lot of fat on my arms that I wanted to get rid of and just pretty much clean up and brush up on my second round.
All right, so when patients talk and they say, oh, I'm going to lose 30% of my fat. Now remember, the fat that I inject is mixed with blood and water, and your body will absorb that. Just like when you're making rice, you don't lose rice, you just boil off the water. But if you do sit on your butt, if you don't eat, if you smoke, you will lose some of your fat cells. All right, so 5 years ago you did the surgery and now you wanted to do your second round. What were you looking to accomplish?
I just wanted to honestly fill out my hip dips, add some projections specifically on my hips and then any dents that I might have had. And then I had a little bit of fibrosis because I wasn't getting enough massages from my first round, and so I wanted us to fix that, which you did, and also remove the fat from my arms. I love my results.
That's one of the big things. Massage, I always tell my dolls, please, if you spend as much money on your massages as you did on your surgery, you're doing the right thing. Massages should not be kitty cat massages. They should hurt. A lot of the medical assistants here and our staff have gotten them, and if they do what they need to do, I've seen them grimace. They're in pain and they're like, oh my gosh, I didn't know it was so painful. If it's not painful, you're not getting the right massages. And if you don't get the right massages in the right way, you're going to get fibrosis, which means things will be uneven, or you can get fluid collections, which of course, most of these things are avoidable. So if you do your part, you can avoid it. Your BMI is 32, but you're very muscular.
Yeah.
I mentioned to you, I didn't think I was going to have enough fat. So we talked about adding some extra body parts.
Yeah.
You agreed to do your arms and your inner thighs. So when I do arms a little bit different, some people just do the back part. I do the side, the back, and the inner portion almost at 270 degree. And it helps make the arm thinner. So a lot of the dolls don't like this side part, so I'll bring this down. Now, if dolls have a larger side on the back, I will leave this part undone to match to make it easier to go ahead and do. Now, for your thighs, I go all the way from the top, all the way down to the bottom. So you had your surgery yesterday. How was your night overnight?
It was good for the most part. As soon as I took my medication, I felt great and I slept well.
You came in this morning. Have you had your massage already?
No, not yet.
All right, so you look at yourself in the mirror. What do you think?
I was ecstatic. This is exactly what I wanted. Inside and outside, it looks great. This is just the first day, so I know once I keep up with my compressions, keep up with my massages, it's going to look even better.
All right, so there are some patients that when I see them, they have an extensive amount of fibrosis, too much, very uneven. They've already had 2 or 3 rounds. I will tell those patients, listen, it is not worth going in and trying to do it. If it is soft, I will try, and if I'm able to get in, I'll keep going, but I like to go deep. She really got a very good result. Total, I got 1,500 cc's. So you were great to add your arms and add your thighs. So you got 750 in each butt.
Perfect.
All right. So again, I think for her, there are a couple of good items. Number one, please make sure you get your massages. Make sure you do not lie on your butt. Make sure that you eat appropriately. You really need to overeat, because otherwise your body's going to give the calories that it needs to your brain and to your heart, and your butt's going to miss out. The second item is, if you're going to do a second round, have some realistic expectations, whether you might need a third round or you might not have enough fat. And again, every doll is different. I can't deliver on every single doll, and it's not because I don't try my hardest. It's just because some bodies just don't cooperate. However, if you get everything you want on your first round or second round, do nothing else and enjoy. If you do need another round, then you will do it. I'm really grateful that you took the time to discuss this with the dolls. Hopefully this helps and encourages them and gives them some realistic expectations. This is Dr. Valladares, hoping to see you soon and make you curvy, sexy, and feel beautiful.